We had a range of different pharmacists from a variety of different backgrounds who came onto the development programme with 360, ranging from pharmacists who worked in a hospital setting to community pharmacists working for big chains to a pharmacist who had been working with a local commissioner. For the beginning of the programme, it was much easier for the pharmacists to bring in some of the skills that they were very familiar with using. So things like medication reviews, medicines optimisation, repeat prescriptions. Some of the pharmacists came in with independent prescribing qualification already. For those that didn't have that, we put them on that pathway. Alongside that, we also worked alongside De Montfort University, and they undertook modules in advanced consultation techniques, minor illness management and urgent primary care.
The general practice role for pharmacists is quite an exciting opportunity. Traditionally, pharmacists are associated being with community pharmacy or in hospital, so coming into general practice was something very new. I came into general practice through the development programme in 2016 with 6 other pharmacists. We all came from different backgrounds, from community pharmacy, hospital pharmacy, and myself from primary care. Some of the more easier skills to transfer into primary care were medication related, so whether that's dealing with medication related queries, helping with repeat prescribing processes and being as a point of contact for advice. So one of the biggest development needs for me coming into this role was understanding how to safely examine patients and having good interactions. And patients don't always understand the role of a pharmacist, and some of the healthcare team don't understand where our skills fit. In a typical day, I will run a morning clinic and an afternoon clinic. I will see patients for medication reviews or urgent on-the-day minor illness appointments as well. I also have telephone appointments for medication queries. So in between my morning and afternoon surgery, I will sign prescriptions for routine medications, process path lab results, reconcile all medication from hospital discharge summaries and hospital letters.
The clinical pharmacy students have been able to offer us a wealth of experience that actually we've never really considered. A lot of them have been able to branch off and actually undertake independent clinics, doing medicines reconciliation, medication reviews with patients, and undertaking their own independent minor illness clinics. They're able to sort of make the whole process very time-saving and actually frees up our doctors to be able to sort of treat more complex care patients. Clinical pharmacists bring a wealth of knowledge about medicines and drugs and interactions, and actually in doing so, I think our overall safety aspect improves.
So on average, the pharmacists undertook around 167 patient contacts per month. So that averages out about 2,000 per annum. And this converts into approximately 28 hours of GP time saved per month. So the pharmacists have been deployed at a primary care home level. So we've grouped together practices so that pharmacists can work amongst them, so groups of 2 or 3 practices where the pharmacist will go out and do sessions across those practices. So in one practice it might be minor illness, same day demand. In another practice it might be long-term condition management, or looking at repeat prescriptions, or looking at medication reviews. The pharmacists that we brought in through the development programme were fully funded for the first year that they were with us in general practice.
So for pharmacists coming into a role in general practice, my advice would be that it is a steep learning curve, but be curious, take opportunities to examine patients, learn new skills. Your supervised time initially will be your best learning opportunity. My key bit of advice for practices that are due to have pharmacists joining them is to ensure all members of the team are expecting the pharmacist and know what their role is. Having been in this role now for 18 months, it's so much better than I expected. What I enjoy most about my role is building those relationships with patients. I enjoy the variety. Every day is different, every patient is different.
Ultimately, the evidence of the impact of this programme is that after the year's development programme with 360, the practices have chosen to employ these pharmacists as full-time substantive posts within their teams.